helping make your life easier. Moms Every Day.
We're so glad you're joining us today for Moms Every Day. Dr. Kristen Simpson from Simpson Dental Associates is along with us to talk about some common dental implant questions that you get at Simpson Dental. This is a procedure that you all do a lot of. And the first question that we want to talk about that you get a lot is, if I get the procedure done, if I get an implant, how long is it going to last me?
Right, and that's a good question. You know, if people are going to make the investment to get an implant, they want to know, is it going to last? And it really does last. I mean, it can last up to a lifetime. I mean, the dental implants are one of the more predictable procedures, and once they're placed, it's about a 95% success rate, and they can last 25 plus years as long as you take good care of them. I mean, you still have to clean them and keep the gums healthy around them. You can't get decay on an implant, but it is still susceptible to gum disease, so you do have to still make sure you're brushing and going to your regular checkups. But if you're taking good care of them, they can last a lifetime. So it's a great thing to replace missing teeth.
Okay, well, when you do this procedure, I mean, this is a serious procedure. You're kind of breaking out the big tools. As far as the recovery or the treatment, really the procedure itself, is this something that is painful for people when they undergo this?
Well, most of our patients tell us they have little to no discomfort after, and a lot of times they don't even need the pain medication. So, as long as, you might have some soreness and need to ice it and things like that as soon as you've had it done. But, we normally do it with local anesthetic, just numbing the areas. But if you want, we can also use conscious sedation. So that's where you're asleep but just won't remember the appointment, and we can place the implants that way, and you'll wake up and be able to have a beautiful smile.
That way you forget all of it. You don't even remember it even happened. Okay,
yes.
So Dr. Simpson, you said another one that you get is when people come in and they get this done, they ask, with implants, how long do I have to wait for my new teeth? So what's the answer with that one?
Well, it depends on what you're having done with the implants. If you're having just a single tooth replaced, we place the implant and it takes some time for the bone to heal around it. If you're having a whole arch done, like we talk about the teeth in a day, which that would be the picture on the right here, you can have it the same day. So you can come in the morning, have all the implants placed, and since we have our own in-office lab, we're able to do the attachments to the denture to get it to fit to those implants and be able to give it to you by the afternoon. So that procedure, you could get it all in a day. With the replacing a single tooth, you have to wait some time for the implant to heal, but in the meantime, you'll have a temporary. So you'll always have something in the spot as the implants are healing.
Okay, so there's all these attachments, there's all these kind of little things that go into this. So when you have this procedure done, is this something that you can feel? I mean, can you tell that you're dealing with it?
Really an implant feels just like a natural tooth and looks just like a natural tooth. So once it's placed, you won't really ever know it's there. It integrates into the bone. It's a titanium, replacement, so you really can't feel it. You're able to eat just like you could with a natural tooth. So it really does look and act just like a regular tooth.
All right, Dr. Simpson, this is the question you get asked a lot. This is the all-important one. Of course, these things come at a price. So when you're looking at this, how much are we talking about?
Yeah, and we do get that question a lot. How much is it going to cost? And it's really hard to tell people that without being able to see them. There are several parts and pieces to an implant. An implant itself, just the first part of it is about $1,500. And then you have the attachments that go on top of it, depending on if it's a single tooth. You have the abutment and the crown. Then it depends on what type of crown you're getting. Or if it's multiple teeth, what type of restorations you're getting on top really determines the price of it. So we really need to see the patient, do an exam, and be able to get a specific treatment plan for that patient. I know people get frustrated when we tell them that because they just want to know how much it is, but people can't give estimates on what it's going to take to fix your car till they see your car. So same with this, we really need to see the patient and be able to give a good specific treatment plan for them.
And another good way for people to learn about what's going on is the dental implant seminar. You have these a lot, but you have one that's coming up, so give us the details real quick.
Yes, it's coming up May 8th at 5:30 at our office, and we explain all the different ways that we can use the implants. We have a patient that's had the procedure done. They can tell you what they experienced, firsthand. we'll show you our office, and then we'll also give you a coupon to get your own exam. So it's a great thing to check out.
It sure is. All right. Well, Dr.
Yes.
Simpson, thanks for joining us. We appreciate it. Thank you all at home for being here with us today. Have a great day, everyone.